Oh, Lindsay said, how did we address it? So since we individually screen and do Zoom orientations with each individual, Leah quickly realized that because they were forgetting the ages of their daughters, and they were not able to in any way, shape, or form articulate anything related to their autism spectrum diagnoses, that they didn't really meet the need for that studio. And so generally, if we have anyone who comes to the studio, whether we think that they're being a little shady or whether we think they just simply wouldn't qualify or make a good expert, we can always send a polite email out that just says, thank you so much for your interest in the community engagement studio. We've actually met our recruitment goals, but we hope to see you in another studio, blah, blah, blah. And so we just, that screening piece, yeah, exactly. It's super key for us. So we will quickly move on to recruitment. So recruiting of experts. Next slide, please. We like sharing these with you guys so you know what you're getting into. This again is just a time breakout of how we estimate doing studio recruitment. We get asked a lot of times, how long is it going to take to put this studio together? We generally tell researchers that it's a 4 to 6 week time frame. However, we know as a team, we've put together 3 studios in less than 2 weeks for a multi-site national COVID trial, but that's because we almost killed ourselves. So we try to set some boundaries with researchers. We have enough experience under our belt now that we know what populations are easier from a clinical standpoint to recruit. Obviously, if someone has a rare disease, doing it virtually has made that much easier because we can pull together folks from across the country, even though it's a small disease population. But this generally, 10 hours is going to be if it's more of a, we just want to hear from a particular community and there's not specific health diagnoses that they have to check off. 28 would be if we're doing like a rare disease studio and we're trying to pull a finite demographic from that group. So just so you had kind of a rough idea, this is our time estimate. And I think it pretty much lines up with our colleagues, but they can speak to that in just a little bit. Next slide. So recruiting community experts. I'm so glad you guys got to see the studio so we could chat about this a little bit. So what makes a good expert? I mean, generally speaking, we want the members to be patients, caregivers, advocate. They could be providers. So we like them to be either the population of interest of the researcher in question, or it could simply be that they are a community-based provider, whether it's, we've done them with dentists, we've done them with social workers, nurse practitioners, but we've also had CBOs, so community-based organizations have come in. We did a great studio in Connecticut with some colleagues, and it was individuals who operated food banks. And the researcher was looking at food insecurity and wanted to implement an educational curriculum and program through food banks, but she needed their feedback to make sure she was designing the curriculum in a way that was accessible and was feasible for them to implement on the ground. So the studio model is very, very, very flexible. Obviously, we want community experts, and we talk about this in our Zoom orientation. We want to make sure they feel comfortable talking in a group and sharing and providing feedback. We have had individuals before who have said, I don't really feel comfortable talking about either my health diagnosis or my health journey, but I'm really interested in providing feedback for this project. And we've said, great, if you don't mind us sharing your information with the research team, you could do that individually if you'd prefer to do that. And so some people have opted to do that, and that's completely okay. There is a place and space for everyone. We also want to make sure that they have at least some interest in the research arena, a desire to see it improved. And I think you saw that coming through. Particularly folks who are living with chronic health conditions have a really strong desire to make it not better just for themselves, but for others. And then the last piece, and this is really important to me because we even had internal debates early on 10 years ago in the studio model. We were questioned about this by some researchers. Community experts do not need to be college graduates. They do not have to have a research background or knowledge. I think it's really, really important that a researcher hear from people that they are attempting to engage in their studies. And this is why, just as an example. We did a studio for a lung cancer screening project. He specifically wanted to hear from older African Americans who did not have higher education backgrounds because he was particularly interested in making sure they were engaged in his study. Part of our studio was modeling his consent document. This was a wonderful researcher. He sat across the table from a volunteer from the community experts, and he said, okay, I'm going to start the consenting process. And I said, wonderful. I'd like everyone in the room to raise your hand every time Dr. Mason uses a term that you're unfamiliar with or you would need them to stop and explain to you. It was such a difficult document to get through. Within 2 to 3 minutes minimum, I'm telling you, 2 to 3 minutes, he stood up and he threw his document across the room and said, "This is a horrible document. Obviously, no one can understand it." Now, he obviously, this was his research project. But this consent document was incredibly arduous. Now, if I had had a group of college educated individuals with research backgrounds who understood the nomenclature and the terminology, that would have been a really different experience. And they still would have wondered why certain demographics of folks weren't joining the study. That was really eye opening for this researcher. He loved his studio, even asked if he could take photos with the group because he really valued their feedback and their advice. And so that's why it's important. Individuals have something to bring to the table, no matter what their background is. And so I think that's just really important to remember. Not the ideal expert. So I will tell you, we, particularly with COVID, learned a lot of lessons. We do a lot of screening because we were working on getting feedback for studies, and it was really important for us not to have individuals with extreme views on either end to distract from the central conversation. So if someone was an adamant COVID denier, then they weren't going to add value to the conversation. They weren't going to be able to give us the feedback to move the project forward. We are not here to convince individuals, right? That's not our goal. And since those individuals tended to be in the minority for this particular study, we did not include them in that dialogue. So it is important that folks with really, really extreme views, in my humble opinion, get kind of filtered out and maybe even put one-on-one with a research team to give some feedback and give them that opportunity and option, but they can be incredibly distracting if you have one person out of, say, 9 in the room who just keeps harboring on something that isn't really even relevant to the study. So that's something to be really mindful for in your screening process. And then for virtual experts, obviously, we do a lot of orientations and things that you're going to hear about, but we do have to minimum have folks who are willing to learn how to use the technology. If someone tells us, I just don't really feel comfortable with Zoom, I don't want to be on the screen, again, we need to find some other alternatives for them currently while we're not able to do in-person studios. Any questions from anybody?
We've got some questions about hosting these sessions with all clinical experts.
Sure. Let's see. I'm looking to see what the specific question was. Colleen, I apologize.
That's Heidi.
It's Heidi. So we were talking about doing our first studio for a project that really needs buy-in from hospital staff and providers. And so we were talking about doing a studio with those people as the experts versus, general population, quote unquote, community experts. And I was just curious about your thoughts on that.
We've done provider studios. I will tell you a couple of things. One, we find it incredibly difficult to recruit providers. It's really hard to schedule them. The providers that we tend to be able to recruit were either provider referred. So the PIs on our project reached out to their colleagues and said, please do this for us, versus us going out and recruiting providers. Or they self-referred because they're really into this kind of space, right? They're really about patient outcomes and patient-centeredness. And so you do get a little bit of automatic bias when you work in that space. So you just have to kind of know that going into it. The one project that we said did not fit the studio model, in our humble opinion, was a project that was looking at pulling together high-level leadership from multiple hospitals to talk about what a collaboration should look like. We felt like that needed to be like a facilitated planning meeting. That wasn't necessarily just soliciting feedback. That was actually an infrastructure meeting that needed to take place. And we didn't feel like that was appropriate for a studio. But we have done just a quick example. We've had providers who have met around interventions that were going to be implemented via their clinics to give feedback on the feasibility in terms of like, when should the intervention occur? Was it too much, too little? How should it be implemented? Messaging, things of that nature. We've had providers give a lot of feedback on patient assessment, so online patient assessment tools that would be utilized via their clinic, and what supports they would need to make that happen, and if the right questions were being asked, things of that nature. So we've done some. I did a great round of 3 studios with a local mental health co-op, which is an organization here in Nashville that was establishing a primary care clinic. We did 3 studios with them. One was with medical providers. one was with their social work case management team, and one was actually with the folks that they serve via the mental health co-op to talk about what the clinic should look like. If you were designing a primary health care clinic at mental health co-op, what does it need to look like? What services should it have, et cetera? That was really, really fun. So that was an exciting project that we got to do. So I hope that helps, but we're always here to talk to you about it.
Yeah, thank you very much.
Absolutely. Did I miss anything else, Colleen? Okay, next slide, please. Okay, so who are the experts? And Heidi already kicked us off here in terms of clinical experts. I feel like I've already given you like a little bit of information about how we can utilize providers in this space, and they can provide some really critical feedback. We did one recently that was on an emergency room intubation project that's looking at two different tools for intubation. One is standard of care and hasn't really been tested in that space before. And we had a number of residents that came to this particular studio. And it was really interesting because they told the PIs, ask us about these things more. We really value research. We're early in our career. We want to be engaged. We want to be involved. And if you ask us early, we can tell you how to set this up from an implementation standpoint. So we always remember, go grab the envelope off the crash cart, go check the board off the thing. Like if you don't build this into our routine in the emergency room, it'll be harder for us. So they were really excited to be involved and they got excellent feedback. Something I really want to touch upon is diversity within diversity and that kind of intersectionality. This is something I think that you guys are going to get questions about a lot. It is not uncommon for a researcher to come to us and say, I'm really having trouble recruiting Spanish speakers. I'm having trouble recruiting Black women. And the interesting aspect of that is that when we start talking to them about doing a studio, they just say, oh, I'd love to hear from a group of Black women, like why they would or wouldn't join the study and the things I might be able to do differently. And we remind them there's diversity within diversity. So we really need to chat about like who really needs to be at the table, and what kinds of questions we're going to be asking. And then that intersectionality piece about the other aspects of these multidimensional people, right? And so not just simplifying the folks that you're talking with. Folks are very complex, and I think that they need to be respectful of that. So for instance, when we use terms like vulnerable populations, well, a lot of different populations of folks could be vulnerable. We could be talking about, individuals who are unhoused, individuals suffering from addiction, folks who are incarcerated, but also folks with chronic health conditions represent a vulnerable group in many spaces because of their inability to access care, afford medications, things of that nature. So I think it's really important just to be mindful of language and nomenclature. And you're going to do a lot of educating, I have a feeling, of researchers that you're working with who are super well intentioned, but don't always have the opportunity to really think through that diversity within diversity piece of their patient population. So that's just something I wanted to make sure I really pointed out. Caregiver perspective can be incredibly valuable. We did a series of ICU studios. They were for ICU survivors. And obviously it was really important that we had caregivers present because many of the ICU survivors themselves were not able to even comprehend or remember or recall some of their experiences in the ICU. So they spoke more to the recovery element while the caregivers spoke to the caregiving that actually occurred in the ICU. And I think we've done probably 6 or 7 different studios with ICU being the focus. So caregivers a lot of times, and I've started using the term more care partners, because when we say caregivers, it kind of implies that I can't care for myself. But when you say care partner, that also includes my boyfriend who reminds me to take my medication every day, right? Or it includes that mom who says, come on, we got to go walking. You're supposed to be walking every day. So I like that term care partner. And then the last piece is optimal number. As you all could see today, like it really flies by. We had less time today to do a studio than normal. We did an hour and a half. We normally do 2 hours. An optimal number is something you have to think about when you think about the group that's going to be there. If it's a highly activated patient group and they're really vocal, again, I think I mentioned this earlier, I've done a whole series of studios around autism. If it is a mom who has a child with autism, then I know I can only have maybe 5 in the room because they're usually really vocal, really passionate, really educated about the topic. but I also know that if I have individuals that have trouble communicating, that I need to give time and space for them to kind of think through their thoughts. I think I mentioned earlier, if it's individuals with Parkinson's or vocal fold paralysis, those are some of the groups we've worked with. In person, I usually can have a few more people in person than I can virtual, just because it's easier to physically and verbally navigate that space. The largest studio we did was by accident, and it was with like 15 experts through the Sickle Cell Foundation. Yeah, we walked in the room and they were like, everybody wants to do it. Is it okay if everyone stays? And I was like, sure, let's do it. And it ended up working out fine, but that is not my preference, obviously, because I want everybody to walk away from the studio saying, wow, that was a great experience. I learned a lot. I enjoyed it. I'm coming back. This was wonderful. So we do over recruit. I'll let you know that we had one person who canceled for today the night before, but I was able to slide another person in their place. And interestingly enough, it was Richard who told me, I will do this, but I don't really feel comfortable talking in groups. I'm usually a pretty quiet person. And I don't know if you all noticed, but Richard was the one who talked the most. So I loved that. Any questions on this slide before we move forward? All right. Colleen, keep me on track, will you?
You and your team are doing a good job. Most of the questions are being fielded in the chat box, but somebody give a shout out if you want to explore something a little bit further.
Perfect, thank you. So my last slide is barriers for underrepresented group. And this is something I really want people to give a lot of thought to. I feel like I'm preaching to the choir when I tell you all how important it is to make sure that community experts feel valued and appreciated, and that the process is transparent. Obviously, we told everyone in the Zoom orientation, we are using this as a training demo. And so we wanted to make sure that you feel really comfortable with folks listening in. We wanted to be fully transparent about that. We didn't want that to be a surprise to anyone. So a couple of things to think about. A couple of things that I want you to think about. When we talk about research intimidation, that can exist for multiple groups and demographics of folks in our country, right? You could even think of that from individuals who you might not normally, oh, they're really educated, they'll probably be fine. But if they don't feel competent and comfortable in that space talking about research, we get asked quite often by people who are highly educated, well, it's weird that you call me an expert. What am I supposed to be an expert in? Like, do I need to do some reading before I come? Do I need to do some homework? And we just help folks understand that it's your lived experience with this condition that makes you the expert. Yes, physicians go to medical school, but there's no way they can possibly know what it's like to live day in and day out with this particular healthcare issue that you're struggling with. The next piece is around disbelief, lack of trust, finding voices. These are things that I want people to think about. I was just watching a video doing some research for a class that I'm teaching, and there was a woman in California who talked about how, yes, the injustices of Tuskegee are really important and we should never forget them. She said, I have concerns that because I particularly see white researchers always referencing it as the reason Black Americans do not participate in research or won't take the COVID vaccine, that's putting the burden back on Black Americans. And she said, it's not just Tuskegee. It's hundreds of years, right? There's hundreds of years of things that have occurred that have built distrust in the community. It was not one incident that folks happened years and years ago. There are modern day instances as well. I was really fascinated doing my research because I found like our own prominent incident in Nashville. And I've done a lot of research in this area that I didn't even know about, but she was the Dean of Women at Fisk University in 1931, Ms. Juliet Derrick, who was in a car accident while traveling through Alabama, and the white hospital refused to treat her. And so she died as a relation to her injuries. And that was something I never knew about. Yes, Ricardo mentioned Medical Apartheid, a fabulous book that talks about how these disparities exist today. So I think it's just really, really important. 2004, GlaxoSmithKline sponsored 4 medical trials using Hispanic and Black children at New York's Incarnation Children's Center, if any of you have heard of that. And while trials normally would require require parental consent. Since these infants were in the care of New York, they did not have to go through that process. And those experiments were designed to test safety and tolerance of AIDS medications. Some of them had potentially dangerous side effects, and that was just in 2004. I could go on and on and on in this area. What I'm trying to say is I think it's really, really important that we be mindful that this isn't one incident, and that it's continuing today. And it's particularly continuing today in relation to the care that Black and Brown Americans are receiving in our hospitals. And so we're asking individuals to join research projects and to take vaccines and to do all these things, but we aren't putting in the work in building that trust. And I feel like studios are one mechanism for us to start rebuilding that trust and helping folks find their voice and their power in this. And then the last piece in terms of competing interest and tech literacy. So we did a studio with a pediatrician. First time she had done a studio, but she's known about them for years. And we did it with moms of children who were going to this particular pediatric clinic. We scheduled this studio in the evening. The researcher was fabulous and more than willing to adjust her schedule. During the studio, we had one mom who was driving to pick up children. We had one mom who was driving home from work. We had another mom who was shopping. She was grocery shopping. And we had another mom who was getting her child ready to go to a Halloween party. And the point I am trying to make to you is these moms had competing interests. And they were all actively engaged in the studio. They were talking, but one was shopping, holding her phone. One had her phone set up while she was driving and was just chatting with us without looking at us. So it was great for this pediatrician to see this, because I think it really hit home to her that these women have a lot going on in their lives, right? And so bigger than just them giving feedback on telehealth mechanisms and how to make it easier and more supportive was her understanding their scheduling difficulties and challenges and how hard it was for them to always be present. It had nothing to do with them not being phenomenal moms. Clearly, they were all in the space of being a phenomenal mom during the studio. And so I think that that's a really important mechanism to make. And in terms of tech literacy, we've had these questions throughout the day, and we are really just doing our best. We're doing our best to educate people and support people. You guys will hear about that in a little bit, and trying to be as creative as possible about finding Wi-Fi hotspots, places folks can sit and still engage with us, or just doing phone only so we don't lose people in this process. So I think tech equity is just an issue across the board that everyone doing research needs to be mindful of, but particularly in studios. And I don't want to mention really quickly, we've got a lot of phenomenal comments, but one of the comments is the race-based differential in GFR that's applied in many health centers. I'm excited to say Vanderbilt no longer does that, thanks to an organized group of student workers and med students who are working hard on educating our institution about changing that. So yeah, that still exists though across the country for sure. I know we could talk all day about this. As Heidi knows, I'm happy to set a Zoom aside for folks if you'd like to chat more about this later, but I am going to turn it over to my colleague now.
I think this is me. So I may speak quickly, and if you have questions, please put them in the chat. And if we don't get them to them today, I'm happy to answer questions offline as well. So when we talk about recruiting, there's a few different ways you can go about it, right? External, we call that looking outside of your institution, outside of the clinic, outside of the hospital setting, and then internal, looking at the clinics and healthcare centers that you have access to. So when we think about external recruiting, we're talking about community organizations. When we began the studio model 5-6 years ago, we began to put ourselves as liaisons on community boards to go out to these community organizations and meet the leaders and to build trusting relationships with them, so that when we needed to reach these communities, we have a contact person that can validate us and share these opportunities so that they can be trusted experiences for everyone. Looking on social media, and I know we're going to talk a little bit more in depth about this, Facebook, Twitter, Instagram, and other online resources can be really helpful, especially during COVID. What we found is that there's ways to target an Instagram post to certain zip codes if you're looking outside of your area, and this can be really helpful, as well as finding niche support groups on Facebook that you can join and talk about your opportunity with. 211 is a resource. Here in Utah, we currently don't utilize 211, but I know that at Vanderbilt, Tiffany and her colleagues utilize this a lot for sharing these opportunities. There's also a website called Aunt Bertha, which is also one that we currently don't use because it's just not popular here in Utah and people just aren't posting to it, but that is a great resource as well. When all else fails, you can Google. We've done this when we've looked nationwide to just Google what's out there, what community centers are out there for these types of individuals. Where do they go? Are they at libraries? Are they in certain coffee houses? Do they frequent a recreation center, and how can I get connected to that organization and that center? And then local.gov websites can also be helpful. I see a question from Alicia about Reddit or Craigslist. We have yet to utilize that. And there's a couple caveats because even on social media, as Leah mentioned, with some experts not really being experts in the area that the studio was about, we've found that even sharing something on a private Facebook page, we've had people from other countries that are really scammers who have completed more than 30 surveys or requests to participate. And then when we call them, they're telling us incorrect information. They're sitting there Googling local high schools trying to tell us where they live, but their area codes are clearly not United States area codes. So just very interesting, and just a caution about using some of these unregulated sites. But I could see if Craigslist was where people went in the community, posting it there would be an option. Community calendars can also be useful. So like our local NPR hub, we can post this opportunity there, and that can be a way to reach individuals as well. Clinical settings, going to practices. We've literally sat outside of a clinic before with a little table and flyers and tried to talk to people going in because we know that people with a certain health condition would be visiting that clinic. Making friends with clinic managers can be really helpful because they can distribute flyers, contact patients, whereas we don't have permission to or access to their email lists. We really find those connections to be helpful. There's a subject locator. Research Match has been helpful, not so much for us here in Utah, as we find very few people are actually enrolled in Research Match. But if your CTSI has utilized that, that could be a great resource as well. I2B2, which is another thing I'm not familiar with here in Utah. And then just one thing we really rely on is the PI. And so if they know, if they have a community connection, if they know of a provider that treats these type of patients, or they know someone in the community, just having a warm handoff can always be helpful. And oftentimes we're asking people we know, hey, do you know anyone with this condition or that has this experience, and can you introduce me to them? And then that one person, maybe they don't qualify, but maybe they serve that population in the community, or maybe they work with someone that does. So it's really about building as many networks as possible. We find that that's the most valuable use of our free time, if we have any, is to go out into the community and to let people know who we are and what we do and how we can collaborate to improve the health of all people. If we'll go to the next slide. So reaching rural areas, and I know we've had a couple questions about this, is extremely hard, especially during COVID, right? Some of these people don't have access to the internet. There aren't a lot of people in these areas. We found an influx actually of requests for rural engagement during COVID, probably because PIs aren't able to travel and go out into these communities themselves. And so, for example, we were approached by a group of family planning doctors who are looking to develop rural health clinics for women in rural areas across the state. So usually we would say, okay, let's contact the library, let's send it to this school or this clinic, but knowing that people aren't going out of their homes during this time was very difficult. So my fabulous colleague Naomi is our recruiting specialist, as she has learned to utilize social media, to join support groups. I've personally attended support groups in rural areas just to share an opportunity. And you really have to go to where these people are at. Thinking outside of the box for recruitment in rural areas is important. Looking at local health clinics, which may not be associated with your medical center or with a certain health plan. Tribal services is huge for us here. We have a lot of people that attend those clinics and utilize those services. So building connections in those areas is really helpful for us. Looking at school groups and individuals, we've contacted school counselors and said, look, I know you're just a school counselor, but you are the gatekeeper to students that have type 1 diabetes because you probably help them, and I need to talk to their parents. So can you share this opportunity with the kids, and maybe we can get it to their parents. And that was successful when we were looking at individuals, young adults with type 1 diabetes in rural areas, especially from diverse backgrounds. PTA groups, targeted social media ads. We're working with individuals in rural areas across the Mountain West, which is 5 states here, looking at HPV vaccine hesitancy and people that have opted not to get the vaccine for their children, and engaging with them so that we can develop, the PI can develop educational materials. So we've looked up zip codes that are in certain RUCA scores so that we know they're for sure rural enough for the demographic that the PI is looking for. Local libraries, and we even had a community expert the other day share that the PO box station is where everyone goes to get their mail. It doesn't get delivered to them. So even if we could find a way to put up a flyer at a PO box station, that would be great. So that's some very quick tips about rural areas, and we'll summarize here with top tips. Is building those relationships with someone in the community and collaborating with them as a liaison to share opportunities. I can call and say I'm from the University of Utah, even though our university is well respected. People, as we've mentioned, don't trust research, don't trust people that they don't know. I'm a white Caucasian woman. If I'm trying to engage with certain population that is different than me, they may not be willing to even have a conversation with me because I am not an insider of their community. So finding people you can collaborate and build those trusting relationships is really important. Meet people where they are at. Where do they gather? How do they communicate? Is it text? Is it email? Is it through a Facebook group? Is it physically mailing opportunities out? We've done that as well. And then if all else fails, go to them, get in the car, drive. I know it's COVID, so this is a little different, but really when we're talking about reaching rural areas, we can't expect them to come to us, so we need to go to them. And then the next slide, please. And I believe that this is going to be Jillian.
Yep, this is me. Hi, everyone. My name is Jillian Duke, and I'm the program manager at Meharry Medical College. And so today we're going to talk about how we recruit using our social networks and events. So I'll just preface with Meharry is new at the studio program. We started our program last year and conducted our first 2 studios in February. So we've only done virtual. So just prefacing that out there. So in the beginning, Meharry created a community members, a community organization partnership survey via RedCap. And so originally we sent that out to community members who have already participated with Meharry during different projects and that such. So they fill that partnership survey out, and in there they can say how would they like to partner with us. And one of those options is to be a research advisor, which is where we recruit for our studios from. So they check, they want to be a research advisor. And then once we get our studio update, we send the flyer to those people first. From that survey, we also created a community member listserv. So basically we send out just community information that they would want to receive. So we have a monthly newsletter that we send out. We send out resources, different research projects at Meharry, events, different programs. So that is where we get from our community listserv. So next, like they talked about earlier, participating in local events. We got a lot of people to do our partnership survey going out to local events, which is obviously a thing that was before COVID. So we are still trying to figure out ways to connect via Zoom and other ways. But before COVID, that picture there, that is actually where we have our free Meharry swag. So we always bring our free Meharry swag to get people to kind of come up to our table. And at the table, we talk about different things that's going on at Meharry, our community listserv that we have, our partnership survey, and get people to sign up through our survey. If you could see small in that picture, we have a little flyer so people can take that and actually fill out the survey on their phone right then and there. So that way, they don't have to worry about it. They filled it out. They've completed that. And so that also has our contact information on there if they would like to talk to us afterwards. And so we tend to do that. So that's what we call our free Meharry swag. This other picture is actually of me and a work study student at one of our other events, which is the Power of Prevention Diabetes Health Awareness Health Expo. We actually have that at Meharry. So we would send that out to our community listserv to have people come to the event, as well as while we were there, people aren't on our listserv, we will sign them up there as well. And then another big event that we do at Meharry is Oral Health Day. And so for that, if y'all haven't heard of it, community members receive free oral health care from our dentistry school, from our dental school. And so they will do that all day. It is a big event. People line up and sleep overnight to come to the event. So we'll have a table there, and we normally get a decent amount of people at that event as well. So like Bree said earlier, it really is just going out in the community and building those bonds so that when you do send out information to want to participate in the studio, people are willing to serve in that capacity. Next slide.
Okay, I'm going to do our best to catch us up a little bit because I don't want to overpreach this. We use Canva. Canva is free. We highly recommend it. We have about a dozen templates we use and customize for different studies. The thing we wanted you all to take away from this is Canva is free, and we color code and brand our flyers to be disease specific or geographically specific or topic specific. So we have a whole host of flyers. So if we're doing HIV, you're going to see colors that are associated with HIV, breast cancer, etc. This green was taken from the Vermont flag because it's a statewide program in Vermont. I thought that was super creative. I think Devin did that one. So that's what we wanted to stick with you. You can do branding on your flyers. We think it's really important to catch the attention of the folks you're trying to catch. And Canva is free. We're happy to share a lot of templates if anybody would like them. Next slide. We talked a little bit about social media, but we wanted to share with you, we do have our own Facebook page. It's branded Community Engagement Studios. And so anyone in our network who's doing studios is welcome to post their flyers and their studio there. Since we've done studios all over the country, we are trying to work this year on building out our social media presence because we need to reach people where they are. So anyone can post there if you're doing a studio, and we're happy to walk you through that and help you understand that. You also have the option of building your own social media presence if you would like. But what we encourage you to do is to utilize that social media presence to then co-brand your studio, utilizing the support group networks that already exist, right? So for kidney disease, for instance, the Tennessee Kidney Network or the Kidney Foundation, if we're doing Autism Network, if we're doing, so we try to post and then we utilize their social network. So we're not solely dependent on our own social media following. It also gives it some validity in the community when they see it come through a trusted partner. So that's what we encourage you to do the most. Not only do we post our flyer, we have a QR code on the flyer they can scan, or we include the link to the pre-screening survey. So it's all one package. Someone sees a post someone shared on their social media page. Hey guys, I saw this was happening at Vanderbilt. Someone might be interested. People can immediately go to the REDCap pre-screener and sign up for the studio. So we try to eliminate as much as that bureaucracy and layers as possible. So hopefully I caught us up a little bit, Leah.
So I'm going to share really quickly about the screening or interest survey. So this is something that Vanderbilt taught me when I attended their CE summit or training a few years back, and something that we have started utilizing, especially during COVID, for all of our engagement sessions. So as the QR code showed on the previous flyers that Tiffany shared, it takes them to this link, which is a REDCap public survey, which is included in our marketing materials and recruitment materials. And the screener can include as much demographic information as you want. We usually ask the PI what they would like to know. We have a generic list that we typically ask for our purposes to gauge and make sure that we're reaching people from all aspects of the community. However, based on their inclusion and exclusion criteria, we can customize those questions. So we have found that this is a great way for people to reach out to us. It kind of takes some of that pressure off of us feeling like we're random strangers going through a phone book calling people to participate, because they're obviously interested in participating in this discussion because they've taken time to fill out this screener. Sometimes we get 400 or 500 responses and we have to narrow that down to 8 to 10. So in REDCap, there's great ways where you can filter out certain responses and make sure you've got 2 from this community, 2 from this community, etc. So we also include gift card options and how they would like to receive those and their preferred method of contact. So we know if they're a text person, if they are an email person. And Ricardo, yes, language preference should be part of the screener as well. This is how we know if we're going to need a translator or interpreter. So that is a great question. And Ignacio, regarding data protection regulations, so REDCap is HIPAA compliant. And we do not share that with our researchers. When we pull out their name and personal contact information, then can share some of the demographic information with our researchers. And a lot of questions are optional, so they're not all required. Obviously, we want as much information as possible. We've even found this great to ask an open-ended question at the end. Tell us more about your experience with, for example, being a parent of someone whose child wants to go into health professions, or someone that, tell us about your experience accessing birth control in your rural area. And people will tell us some of their experience, so we know if they write 2 pages, oh boy, that person's going to have a lot to say. If they've had a really negative experience, it kind of helps us to get to know our participants beforehand. So these screeners are really helpful, and we're happy to share some examples of those, I'm sure, from all of our institutions. Next slide, please. Preparing community experts. So this has changed a lot in person. This would usually occur over the phone. We'd talk about what a studio is, why their input is so valuable and important, what to expect from the experience, and then what we would be reviewing as well. So you can see orientation, confirmations, materials, and reminders. Many of that was done via the phone, sometimes in person, sometimes through the mail. If someone preferred that, we would send physical copies of the questions or summary or materials beforehand. And then we'd reiterate all of these expectations at the beginning. Here in Utah, we do about 9 points of contact before each studio. So that starts from the very beginning when we respond to their screener response. And then we have a conversation with them, share the opportunity, follow up with them, share the materials, follow up with that, send multiple reminders, and make sure that they feel invested, because then we have a really high retention rate. We generally only have like 1 person that will not show, versus before we started doing so much points of contact, we had a lot of people that just wouldn't show up because they didn't feel that they cared, right? They felt like they were just signing up for a focus group where you just show up and you're not really a person. For virtual, we, as Tiffany mentioned, do Zoom orientations, review how to use that technology, confirmations, and providing the Zoom link is really important, making sure that people know how to use the basic functions of Zoom. We share material via email at up to a week beforehand. So it just depending on, we send it a couple times because, you know, if you get an email, maybe you read it that time, but you don't read it until the day before. So we just share it as many times as is appropriate. And then this gives experts a general idea of what questions we'll be asking, so they feel prepared not only to respond for themselves, but as we saw in the sample studio, to speak for people like themselves, family members, community members that they know that have had similar experiences. And then that's a little bit of differences between how we prepare these community experts before and after COVID. Next slide. And I think this one's still mine. So orientations occurs over the phone for in-person or occurs via Zoom. We still conduct some of ours over the phone or even via email, just based on their experience. In our screeners, we ask how comfortable they are with the Zoom platform. or if they've utilized it before, and if they would like extra support, then we provide a one-on-one Zoom consultation. We explain what the CU Studio is, because that's really important so that they know what to expect, right? This was important even in person, because you don't want to show up to something and not know what it's going to be like. And then remind the expert of the study focus. For virtual, making sure that everyone knows how to use the audio and visual functions in Zoom. As we saw earlier, having someone that's dedicated to tech support that can respond to text messages or call someone and walk them through logging on if they've forgotten, that's helpful. And then any other items. So if the session is going to be recorded, how many people to expect at the session, as much preparation as you can give participants, the more comfortable they'll feel participating. The next slide, please. And this is a sample orientation guide. So this would be sent out via email that describes, these could be all in one or many different emails or many different conversations about how to use these different features and what a studio is. So this is, I believe, in the packet that you were sent. Next slide. This again is our Zoom guide, so how to download, and we've got images. So this is, we've had individuals that have never that don't own a smartphone, that have never used a video beforehand, figure out how to use Zoom, and it's really refreshing to see some of these individuals be able to access this technology. Next slide.
Great, and thank you, Bree, for going over that. Next, we're going to talk about confirmation. So as he's explained, after you do your Zoom orientation or your in-person orientation over the phone, you will send out confirmations. So that could be done via phone, email, and or text. And so normally what we've been doing here at Meharry, since we started virtual, we will send out confirmation emails. And so in that confirmation email, they'll remind you again the date and time of the studio, any materials that they want the community experts to review before the studio, expectation reminders, and then my contact information. So I think all of us across the board use Google Voice. So instead of sending out your personal cell phone number or office number, we all created a Google Voice account. So that way, whoever has the account information can send text messages, they can send phone calls, they can receive phone calls, can receive voicemails. So it pretty much works as a regular number, as your regular phone. It's not connected to your actual personal information. So in case it does, like you said, your flyer or something ends up somewhere where you don't want it to be, people don't have your personal phone number. So it is really important to provide the confirmation again before the studio, just so it's another reminder, another point of contact for your community experts to remember. They are people just like you and me, so they forget things, they're busy. And a lot of our studios have been in the evening, so that also, like I said, conflicts with if you're a parent, your kid has activities, that kind of thing. And also in the virtual confirmation, like I said, we also provide the Zoom link. And then if they have any compensation forms that you have to fill out, we'll make sure we put that in the confirmation email as well. Next slide. Okay, and now we're going to talk a little bit about expectation reminders. So during our Zoom orientation, we like to set some expectations for the community experts, just so they know kind of what they are getting into. And that's kind of what this picture is of just the little expectation guide that we'll send out. Some of the things we talk about would be finding a quiet and comfortable place to sit for 2 hours to participate in the studio. Make sure to have your camera on for as long as possible. We try to highlight that we really want this to be as engaging as possible, and we can only do that if your camera is on so we can see you. Another thing we highlight is avoid doing other tasks that could be distracting to the facilitator and other experts while you are on camera. We just want to make sure that it's a respectful place. We also highlight in ours to make sure that you don't share anything that goes on in the studio. As Tiffany mentioned earlier, some people do divulge some very personal information in the studio. So we want to make sure that they know that it's not going to go anywhere outside of the studio. So those are some things we highlight during there. Again, like I said, we do send that during our orientation, our confirmation email. And again, if you have any questions or highlight, I think this is also going to be in your packet too, this example of the reminders. And next slide. Okay, now we're going to go into post-studio logistics.